good afternoon to the residents of Bermuda who are watching this press conference this evening. I want to start this press conference with an apology. It has certainly been a very long day with a cabinet meeting and also the Minister of Health trying to make sure that we can keep the public as up to date as possible with the latest results that are coming in. And it is certainly a challenge, and we want to not come here without information, because I know that members of the public look forward to receiving information from the government. This coming Saturday will mark the 14 days of shelter in place for Bermuda. We have been guided by lessons that have been learned in other countries and also the advice of our own public health experts. The imposition of the restrictions has been targeted, aimed at reducing the risk of community spread of the virus, and most of all, making sure that we save lives. It is regrettable that the nature of this disease is such that it can end in the death of those of our most vulnerable demographics. Our mission, therefore, must be unchanged. We must protect all of our residents, especially our most vulnerable. Therefore, following the unanimous recommendation of the Public Health Emergency Response Team, the Cabinet today determined that the current shelter-in-place regulations should be extended for an additional 2 weeks through May 2nd. I'm keenly aware of the impact that this extension will have on how we work and live and play. There is an emotional and psychological effect on all of us as we seek to manage our response to this global pandemic. But guided by the need to save lives, we must continue the adjustment to our routines and encourage our families and friends to comply with the new normal of social distancing and heightened personal hygiene. The decision to extend this shelter in place was not taken lightly. We recognize the financial hardship this is imposing on many families and businesses. We understand the extreme stress, and I empathize with the extreme stress that many Bermudians are facing with the uncertainty that this is impacting us and also the uncertainty with the world. We all long for and want for our lives to go back to the way they were before, but it is for the preservation of lives and protection for health and safety of our community that the Cabinet, upon the advice of our public health experts, has made this decision. I have spoken with the Leader of the Opposition to inform him of the decision of the Cabinet. The Leader of the Opposition and I are trying to keep in close contact, as it is very important that these particular matters are handled on a bipartisan basis. And I've also informed His Excellency the Governor, and I will have my regular meeting with the Governor tomorrow morning at 9 a.m. to discuss this, and I'll be able to update further details, and I'll give some further details about what may change over the next 2 weeks later in this press conference. Today, I'm joined by the Minister of Health, Kim Wilson, the Minister of National Security, Wayne Keynes, the Chief Medical Officer, Dr. Cheryl P. Ball, and the Chief of Staff from the Bermuda Hospitals Board, Dr. Michael Richmond. The Minister of Health will start with an update from the Ministry of Health, and then we will go on to the Chief Medical Officer, the head of the hospital, and the Minister of National Security. Minister of Health.
Thank you, Premier. Good afternoon. I want to open today by reminding us all that, as we have seen around the world, COVID-19 is a rapidly evolving situation. The disease was only discovered in late December, and in less than 4 months, it is ravaging the world. Just when we think we understand how it works, it throws us another curveball. Until recently, asymptomatic individuals were not thought to be contagious, but now, as it has been found, that persons without symptoms can transmit the disease. Until last week, evidence indicated that you could not get it twice, and now the evidence, which is being gathered still, says that it may be happening in that regard. I think the takeaway from all of this is that the evidence is growing as the disease spreads. Guidance changes daily. No country has it completely under control, but with your help, we think that Bermuda has a strong chance of faring better than many. And now for today's test results. As the Premier indicated when he commenced his remarks, We received our test results rather late today. We received 38 test results just about 5 o'clock p.m. So we are still processing them as well as contacting individuals and their doctors. However, I can say that no additional hospitalizations have taken place today and that there have been no reported deaths as well. So again, the test results were received rather late this afternoon, but a full report is not yet available, but upon completion of the analysis, it will be posted online as soon as possible. Whilst, and it has been said previously, COVID-19 in most cases, in fact in 80% of the cases, would represent a mild condition. Again, COVID-19 will represent a mild condition in 80% of the people. And it can make some vulnerable persons seriously ill. Seniors and persons with prior chronic conditions are at a higher risk and need to take extra steps to avoid becoming unwell. And this is what we refer to as shielding, which I mentioned briefly yesterday, and I wanted to touch a little bit more upon that this evening. Vulnerable persons are persons who are at a high risk of severe illness from COVID-19 due to an underlying health condition and may require an admission to hospital. Vulnerable persons are those who have one or more of the following conditions or circumstances: solid organ transplant recipients, individuals with specific cancers, women who are pregnant, especially those with significant congenital or acquired heart disease, individuals currently taking immunosuppressant therapies that will significantly increase their risk of infections, those with severe respiratory conditions, including cystic fibrosis, severe asthma, or severe COPD, HIV-positive persons not managed by HIV treatment or those who have a low CD4 cell count, individuals with severe combined immunodeficiencies, and those with severe obesity, and that's defined as a body mass index of 40 or higher, or those with poorly controlled chronic conditions, especially related to heart disease, respiratory illness, or diabetes. Shielding is a measure to protect the extremely vulnerable population by minimizing interaction between those who are vulnerable and others. The shielding measures that must be taken are as follows. Stay at home at all times. This means no trips to the grocery store or pharmacy. Ask a friend, a neighbor, or a family member to bring you the supplies where possible, or use delivery services if you can. Most pharmacies on island are offering a delivery service so that you can contact your local pharmacy to make those inquiries. Minimize all non-essential contact with other members of your household. Avoid any face-to-face contact. Strictly avoid contact with someone who is displaying symptoms of coronavirus, which include high temperature and new or continuous cough, and do not attend any gatherings. Visits from those who provide essential support to you should continue. However, caregiver and healthcare professionals should stay away if they have any symptoms at all of COVID-19. All people coming into your home should wash their hands with soap and water for at least 20 seconds on arrival to your home and often while they remain in your home. All of this advice can be found at coronavirus.gov.bm. But the main thing that we can do now to protect our vulnerable is to follow the current shelter-in-place directive. A risk to one is a risk to all. Did you know that there are over 2,243 people in Bermuda with uncontrolled diabetes, 1,357 individuals with an immune deficiency diagnosis, or that there are 8,625 people over 65 receiving complex care? And I'm sure that we know a vulnerable person within our community. It is along this thought that the Ministry of Health is today launching its Who Are We Protecting campaign. We are asking members of the community to submit a short clip of no more than 15 seconds about who are they protecting by sheltering in place. For example, by staying inside, I am protecting my grandmother who turns 85 years old next week. I'm protecting my sister who has chronic asthma, or I'm protecting my neighbor who has cancer. If you do not live with that individual, hold up a photo of them or have your child draw a picture of them. The more creative, the better. And don't wait. Take time to submit one tonight. People can send them to the Ministry of Health via email to moh@gov.bm with the subject line, "Who am I protecting?" or by sending it to WhatsApp to 504-6045. The deadline for submissions is Monday, the 20th of April, and this will be posted across social media as well as YouTube next week. So under shelter in place, there are several requirements of businesses that are still allowed to operate. I want to share that the government has published directives for safe operations by permitted businesses under the Emergency Powers COVID-19 Shelter-in-Place Regulations 2020. And this advice includes the following. Limit the number of people in your establishment at any given time to maintain social distancing of 2 meters or 6 feet between customers while shopping and during checkout. This can be achieved with pre-measured markers throughout the store and at checkout lanes. Encourage customers to use cards and avoid cash transactions as much as possible. Encourage customers to use a delivery option if possible to reduce congestion at your establishment. Social distancing should be maintained even during delivery, and deliveries can only be carried out by an authorized person. Encourage and facilitate hand washing and hand sanitizing for customers before they enter your store, and where practicable, place sanitation stations throughout the store, particularly at checkout. Regularly clean and sanitize frequently touched areas within the store. And finally, a cloth face covering must be worn by all persons working on site during their shift to slow the spread of the virus and avoid transmitting it to others. In addition to wearing a cloth face mask, employees should practice regular and frequent hand hygiene, avoid touching the face, and maintaining social distancing. Further details on the above can be found at coronavirus.gov.bm. Echoing my earlier statement from the weekend, I also want to take this time to thank St. John's Ambulance, who have been helping the Ministry of Health and indeed the entire island throughout this pandemic. I can also announce that this week a $20,000 grant was provided to them from the Emergency Fund for providing transport for persons in the community with symptoms consistent with COVID-19 and for whom urgent transport via emergency medical service is not required. Specifically, this refers to either persons without means to safely transport from their residence or the quarantine station to the COVID-19 testing centers, or persons requiring transport from their residence to a quarantine station for isolation. This $20,000 will help to cover approximately 40 trips and can be boosted as needed. I also want to give thanks to the Bermuda Hospitals Board, who have been working hard to increase capacity to cope with seriously ill patients with COVID-19 and to allocate more beds for potential future COVID-19 patients. But we need more beds. This means anyone who is medically fit for discharge must go home so that all possible beds are available. I understand that some families are resisting taking their loved ones home, but this is not a choice anymore. The country needs these beds in case more people fall seriously ill with COVID-19. We have seen the pressure that hospitals can be under in other countries when they run out of beds. Everything we are doing in this community is to prevent this by reducing the spread of the infection. But the facts are right now that we don't know how high the numbers are going to go. This means you need to do your part and be part of the solution by taking your loved ones home when they are medically fit to leave hospital. These beds are needed by the country. They are needed to help healthcare workers so that they are not overstretched, and they are needed by people who may fall seriously ill and need care. Please work with the hospital to receive your family members and help our hospital prepare to care for all of us in the community. Ultimately, the majority of cases will remain in the community, so it is important for everyone to understand a little more about contact tracing. And we've seen a lot of questions of late have been asked concerning contact tracing, why it's done, how it works, and what it means to you. And with that, the Chief Medical Officer, Dr. Cheryl Peatball, will share more information with us this evening concerning contact tracing. Thank you.
Thank you. CMO, please.
All right. I decided not to prepare remarks because I thought it might be a bit easier to have more of a conversational sharing about contact tracing. But in starting, I think I should say that there is quite a lot of uncertainty around COVID-19, so much so that even the so-called experts are very uncomfortable being called experts. There are no experts in COVID-19. We're all in a very humble posture of learning, and it is important for, I think, the public to understand that there are no easy answers. Rarely are there easy answers in healthcare, in fact, but in this situation particularly, it is an unusually dynamic situation where the research cannot keep up with the questions that families have. And in the epidemiology and surveillance unit, what we often have to manage are the feeling of what information is family needing to cope with the situation that they're in as it relates to COVID-19. These patients are known to us only as Bur 1, Bur 2, as in Bermuda. They're anonymous, but as the minister and the premier yesterday pointed out, these are people who are very connected in the community, who have their mothers and fathers and aunts and uncles. And so those families have lots of questions about what happens now once my family member has been diagnosed with COVID-19, and what is contact tracing, and what can I expect to happen. And everyone has an opinion as to what should happen, so I think it's very helpful to understand that the why of what contact tracing involves, and particularly to be reassured that the process of contact tracing is not arbitrary. It's not something that we make up as we go along, but there are principles to contact tracing, and that the primary principle is to start with the most physically intimate group of individuals to a case. So when someone is diagnosed, we look first at their household contacts, the people who are intimately in connection with them physically, and then from there move out to secondary contacts, which might have been in the workplace or in school setting or in social settings. And it is very tedious work. It is not work that can be rushed, because it is delicate work. It is calling someone, a cold call almost, to a household, asking questions that are of a very private nature in a situation that's very emotionally heavy. And so those who do contact tracing, and at the moment they're nurses primarily, but also other healthcare professionals, are equipped to ask a standardized set of questions, but to ask them in a very delicate fashion in order to find out what the symptoms are of the case, the person who has been diagnosed in the first instance, how they're doing, whether they are under proper medical care, and then to find out really who they've been in contact with in the preceding 14 days. And you can imagine how difficult that is for a person to recall, even under the best of circumstances. Most of us couldn't tell you who we've been in contact with yesterday or last week, but 14 days is the objective for contact tracing with COVID-19. And so the process of interviewing an individual newly diagnosed of COVID-19, reassuring them, comforting them, allowing them time to think and to figure out who their contacts were, getting permission to reach out to those individuals. And one of the key things that the contact tracers do is to find out from the individual who's been diagnosed not just the contact information of those individuals that will need to be reached out to, but to please let them know that they will be reached out to by public health, by a nurse probably, so that there is a level of trust and an acceptance to the outreach. And there then are these subsequent conversations. And if individuals have had symptoms of illness and did the right thing by isolating themselves, they may have very few contacts, very few people who were close to them, physically close to them, in the period when they started to become ill. But if they were not really mindful of their symptoms and went to work or went to school or visited friends and relatives, sometimes there can be large numbers of contacts, and we have the whole range, from 2 or 3 household contacts to whole offices. So that is one of the lasting comments I'd like to make with regard to contact tracing, that with all the uncertainty, one thing is certain, that there is something individuals can do in this setting of COVID-19, and that is to be mindful of their symptoms, to observe public health advice, particularly once they're diagnosed, to be isolated and remain isolated, even to their family as best possible, in a separate room, using a separate washroom facility, if that is an option, and to maintain that isolation for the duration of their illness, which for some people may seem like overkill because they don't have a lot of symptoms. And I think it's those cases that pose the greatest risk, that if you're not very sick, you still have to maintain the separation from loved ones and the public for the full 14 days at least, and an additional 3 days until there are no further symptoms. So for some people, if the illness is protracted, you may be in isolation for weeks. That is, you may have symptoms for 2 or 3 or 4 weeks perhaps. That's one example of why the 14 days is not hard and fast, but people have to be mindful of their symptoms. That is the minimum, 14 days and 3 days after all symptoms resolve. So with regard to contact tracing, I think I just want to end by saying that it's important for the public to understand that these questions have to be asked, and it's especially important that the answers are forthcoming, that people understand that it has to be done, and also that the general public, when they are reached out to as a contact, that they understand the limits of the individual case's privacy, that the names cannot be given, that we honor the need for privacy and confidentiality of the individual who is the case, but that we need to ask them to understand that in the interest of their health, they have been identified and should be forthcoming with information. I could go on, but I think it would take us too long, and I'm sensing that my time is up, so no. Really? Shall I continue?
Yeah,
okay. We have had a number of calls around the issue of revealing who the case is, and I just want to put a fine point on that. That is that we are not able to reveal who the case is to the contacts, and that may seem unfair, but we put it in words like this, which is that the case cared enough about the contact to name them and to reach out to public health to give them advice to protect them. So we hope people understand that. I believe I was also asked to explain what people should do if they think they're exposed. There are a lot of worried people who feel anxious around the situation and think they might have been exposed because they were in contact with someone they heard had been affected. And the bottom line is you reach out to your doctor. You have a call to your doctor and explain the situation. And it is through that conversation that it's determined who is in need of testing, and arrangements are made through a predetermined protocol so that there is some orderliness to this process. We're not at the point where people can self-refer for testing. And I think I will stop there for now. Thanks.
All right, thank you very much, Dr. Peakball. And the Chief Medical Officer has been doing fantastic work with her and her team. There are certainly good days and bad days as we manage this particular pandemic. And today, I saw the Chief Medical Officer upstairs, and she asked me how I was doing, and I said, well, today's a better day than others because we got some good news on the supplies front. So from our perspective, we're continuing to chug along, but I am grateful for the work and energy of the Chief Medical Officer and her entire staff, and the dedication in which they have to their craft, because I'm sure that in the twilight of her career, she never thought that she would be dealing in a once-in-a-century pandemic, but that's what we have, and she's done an incredible job. I would like to now ask Dr. Richmond from the Bermuda Hospitals Board, the Chief of Staff of the Bermuda Hospital Board, who will discuss the recent preparations made by the hospital to handle the number of COVID-19 cases that are currently in the hospital and future cases. Dr. Richmond?
Thank you very much. The first thing I would like to make comment on is a special thank you to all of our staff at Bermuda Hospitals Board. We have approximately 1,800 staff, and never before, I believe, has a team been tested as it is at this time. Communicable diseases and the management of them is the ultimate team effort. And when I talk of a team, it is from all parts of the organization, whether it is the consultants, whether it's the nurses, whether it's the housekeeping staff, the catering staff, whether it's the frontline emergency staff or the first responders. King Edward's and the Mid-Atlantic Wellness Institute is intensely grateful for the efforts of the staff. You may say, well, why am I not talking immediately of the patients that we serve? But without the endeavours of the staff, the patients will not get the care that they so richly deserve. The staff at the moment are doing a great job, and they're doing a job against a backdrop of the challenge that very few of us have got experience of dealing with. We're obviously dealing with patients who are coming to the hospital. Many of them have symptoms, but some do not have symptoms. And as of the beginning of April, the 1st of April, we started to test all of the patients that were being admitted to the hospital. That's had a benefit to the healthcare workers in the fact that our current number that are on quarantine has significantly dropped. We currently have 12 members of staff on quarantine. We are indebted to the testing service, which is giving us results as quickly as they possibly can, which is allowing us to have confirmation of the caseload that we are managing. Our current efforts are obviously to make all of the appropriate preparation as we go forward, and Minister Wilson referred to how we are increasing our bed capacity, our acute bed capacity, and that's for receiving incoming patients. And we have at this current moment in time have an additional 30 acute beds that are in place, and we are also increasing, as I've said before, we're increasing our intensive care capacity from the normal establishment of nine beds to the ability to ventilate at this moment in time close to 30 patients using alternative facilities. Our supply of personal protective equipment is a constant challenge. In terms of our number one priority is that our staff safety is preeminent in our thoughts, and we have a supply of personal protective equipment, but we look forward to any incoming stock which will give us a greater resilience as we go forward. I think the additional thing that I would want to make comment of is that in reference to the fact that this is an island challenge and the hospital is only part of the island solution, and all of the work that has been done to date is connected to get the best possible result. On its own, the hospital only has a certain ability, but as an overall integrated team in terms of what is happening in the community, I believe, and other jurisdictions have demonstrated this, that the suppression of the curve, if you like, has got the greatest chance of not overwhelming the provision that the healthcare services can deliver. that was all I was going to comment on.
Thank you very much, Dr. Richmond. And Dr. Richmond, I'd like to echo your comments in giving thanks, certainly, to all of the staff and doctors and nurses and everyone else at the Bermuda Hospitals Board for all of the work of which they have been doing over the last few months. I'm grateful. I managed to be in the hospital a few days ago, and I actually saw some of the work that is being done to convert existing space and to make sure that there can be additional capacity in case that capacity is needed. And I'm certain that our hospital is well prepared for any possible surge that may come, but our job is to make sure that that capacity is planned in the worst case scenario, but never has to be actually used. Thank you very much. I will now move on to Minister of National Security, Minister Keynes, who will give an update from the Ministry of National Security. Minister.
Thank you, Premier. I will now share a general update regarding the uniformed services that fall under the Ministry of National Security. The Bermuda Police Service. Earlier today, the Police Commissioner addressed an incident of an impaired driver who coughed on a police officer. The impaired driver said that he had COVID-19. The BPS officers were managing the incident exercised professionalism and enacted protocols. Regrettably, these officers are now quarantined to ensure their safety. Bermuda, this type of behavior cannot and must not be tolerated. This is considered a serious assault and will be dealt with accordingly by the courts. The Bermuda Regiment. The Bermuda Regiment continued their deployment across the island, providing support in a variety of capacities. The community advisory points recorded a total of 13,633 stops on Monday, April 13th. The total number of stops over the last 6 days are 44,600. I should note, however, that the majority of the stops were by exempted persons. Yesterday, community advisory points were conducted at 21 locations across the island. 107 soldiers were directly involved with the operation. The Bermuda Coast Guard continued to maintain a daily presence over Bermuda's waters to ensure both that the COVID-19 emergency order is enforced and to ensure 24-hour search and rescue capability. Some of yesterday's Coast Guard activities included the towing of a vessel with 3 people to North Shore, where they were met by members of the Bermuda Police Service. Members of the Coast Guard also participated in a training exercise with RFA Argus and the Wildcat and Merlin helicopters. Please note that the helicopters are working in conjunction with the Royal Bermuda Regiment in identifying potential landing sites if required after a major hurricane. To be clear, there were no contact between the crews of the boats and the helicopters. Additionally, the Royal Bermuda Regiment soldiers accompanied BTB drivers who were operating a special bus service for members employed by the Bermuda Hospitals Board or our healthcare workers. The Bermuda Fire and Rescue Service. Emergency medical technicians from the Bermuda Fire and Rescue Service continue to provide emergency response for all medical-related incidents within the community. Since April 1st, the Bermuda Fire and Rescue Service Dispatch Center has processed a total of 172 medical calls. The Bermuda Fire and Rescue Service Dispatch Center has heightened its questioning at the receipt of 911 EMS calls to identify the at-risk population. The Dispatch Center has taken guidance from our local health care professionals as they field a number of COVID-related queries. The leadership of the Bermuda Fire and Rescue Service continue to do their due diligence in keeping the frontline staff informed and updated on the latest information and recommendations regarding the response during these challenging times. The Customs Department. The Customs Essential Operation Units, they are functioning. The commercial operations, or the long room, as some call it, continue with electronic submissions. Customs continue to closely assess the seaport operations to ensure that they manage any potential container processing backlogs. The team at our ports of entry continue to assess arriving vessels, such as yachts, to ensure that they are adhering to Bermuda's emergency order guidelines, protocols that are set in place. The Department of Customs are working on a rotational basis and are performing remote tasks from home where and whenever possible. The Department of Immigration. The Chief Immigration Officer and her team continue to work to meet the needs of its stakeholders in these challenging times. The department will be exercising flexibility with employers, agencies, visitors, and the general public in light of the current circumstances. The Corrections Department. The Bermuda Department of Corrections continue to operate on a reduced regime. Inmate visits have been suspended. Visits to facilities by vendors and other external agencies, including government departments, have been put on hold unless they are essential. And these visits are only allowed when approved by the acting commissioner. Additionally, non-operational staff continue to work remotely. Staffing levels have not been impacted, and correction staff continue to carry out their duties professionally despite the challenges. With the assistance of correction staff, inmates are working on the Mask Task project, which involves designing and sewing masks for both inmates and staff. In lieu of regular face-to-face visits, the Department of Corrections will introduce virtual visits for inmates in all facilities commencing this week. We recognize that our correction staff and inmates alike are concerned about the potential implications of COVID-19 in our facilities, as well as impact on our island in general. However, the Department of Corrections continues to ensure that every effort is taken to mitigate any risk of the disease affecting the staff and our inmates. Before I close, I would like to thank the members of the Royal Bermuda Regiment for their service, the Bermuda Police Service, the Department of Customs, the Department of Immigration, and the Corrections Department. And whilst they are not members of the Ministry of National Security, I would like to thank the men and women of stevedoring services who are also working on behalf of the people of Bermuda.
Thank you, Minister. And I echo your thanks to not only our uniformed services, but our stevedores who are working on the docks to ensure that Bermuda remains supplied. As plans are being put in place to extend the shelter-in-place order, a cabinet subcommittee has been created to address a number of community concerns, including the needs for laundromats to open and access to business supplies to make the best use of time at home for repairs to our own homes or upgrades while we have to remain at our homes. The committee will make recommendations on how to address legitimate concerns raised during the initial shelter-in-place order under the simple condition that households continue to not mingle with other households and to maintain social distance. The committee will make recommendations, and the determinations will be announced on Thursday to give persons time to plan for the next 2 weeks. The extension of the shelter-in-place will not be easy for many of us. I know that this is without question a challenge, and all of us want to get back to our regular lives and routines. Yet, as a people, we must make this sacrifice, a sacrifice which is based on compassion for those of us who will die if they contract COVID-19, compassion for our healthcare workers who will be overwhelmed and have their lives further put at risk if we do not limit and contain the spread of this virus. However, while we sacrifice, we cannot let the economic effects of this pandemic be worse than the health effects of this pandemic. As an entrepreneur, I understand the incredible strain that this closure has caused many small and medium-sized businesses. While we have announced relief for employees, many businesses also require said relief. And so tomorrow, we will be announcing our small and medium-sized business relief package with the Bermuda Economic Development Corporation, in addition to the Minister of Finance, who will go over general matters for the economy and work of which we're doing to ensure that our economic recovery can happen once we come out of this period of challenge. I do want to say another note dealing with small and medium-sized businesses before I move on to the rest of my comments. And to the email address premier@gov.bm last night, I received a number of messages from persons who run daycare centers who were upset at the comments I made last night. I'm a big enough man that I can apologize and I can say I'm sorry if I offended anyone due to the tone and nature of my comments. I did not try to loop everyone inside of the same group, and I recognize that there are different circumstances for different persons. I do understand that many daycare services are actually providing some form of remote learning and support, and I do recognize that others are taking care of their employees. What I will tell you, as you have been closed down by the government, just like many other businesses, the relief package of which will be announced tomorrow will also be there to assist you during this difficult time. Each of us must seek new ways to define this time for ourselves. We do have the opportunity to learn and grow during this shelter in place. We can take advantage of the free learning opportunities that are offered online or through the Department of Workforce Development and the FinTech Business Unit. During the next 2.5 weeks, I'm going to ask persons to take responsibility for their actions because, unfortunately, we are still hearing stories of people participating in activities which are, at this point in time, unlawful, done in the full knowledge of increased cases and deaths that are occurring on our island. The stories that I'm hearing of the breaches are taking place across racial and economic and social boundaries. And we have to remember that this disease does not see race, employment status, or nationality, and neither does the selfish, reckless stupidity that has revealed itself within our community. And yes, I have said that, because in some cases people are being selfish, people are being reckless, and they are not acting with the basis of common sense. Understand every single point in time that you mix and mingle with persons who are not a part of your household, whether they be still allowing children to go over to other persons' houses for play dates, neighbors standing together and commuting, not wearing masks and actually not maintaining social distancing and talking, you risk spreading this virus to your family. The reason why we are extending this shelter in place is the advice is for 2 complete incubation cycles, given the recent increase in cases which we've seen. If you do not follow and observe these rules, you can put yourself and your family at risk. The vast majority of Bermudians are following these rules and regulations, and I would implore you, if you are not, think about it. I do not want there to be a situation where there are more and more of our vulnerable persons who succumb to this illness. I know that this is not vital, but it is important to save lives. As I close today, I'll reiterate that the shelter-in-place order will be extended until the 2nd of May. The measures that have been in place last week and this week will largely remain. There will be some modifications, as I can recognize the pain and challenge that this may cause people who do not have laundry facilities at home or who need access to certain items which are not there. However, we are going to make sure that we maintain that families should not intermingle to make sure that we reduce any possible transmission of this virus. I also have to remind everyone, if you are leaving home, please wear a mask or a homemade face covering. During this time, my cabinet colleagues and I have been encouraged by the warm emails, phone calls, and messages of support. And I'm also encouraged by those persons who contact me to say and make recommendations or suggestions on things we might want to consider doing differently. The job of the government is to represent all people, and certainly in this particular case and instance, we are all in this together. We thank you, and we are humbled to represent you at this critical time in our island's history. Our island and its people remain at the center of our thoughts, our decisions, and our actions. I thank you for what has been an extraordinarily long press conference, but I also will now welcome any questions that you may have for myself, the members of the Ministry of Health and the hospital, or the Minister of National Security.
Good evening and thank you. Just touching on the next 2-week lockdown, with the vaccine possibly 12 to 18 months away, it seems social distancing is the primary mitigation tool. It's been said overseas that lockdowns should ideally be about 90% compliance and at most 10% enforcement. Are you confident that going forward, Bermudians will be able to comply to the extended lockdown?
Yes, I am confident that Bermudians will be able to comply because by and large, most people have been complying to this point in time. And I don't like to use that term, it's shelter in place. The fact is that words do matter, and this is not a situation where we're asking people to be prisoners inside of their own homes. That's not what it is. But it's important that we maintain this social distance, and as we engage in a pattern or a policy right now of suppression, it is vital that we have persons that are complying with this. It is essential that we continue to work during this construct so that we can give our public health infrastructure the time of which is necessary. But in the short answer, I do believe it will be successful because I am certain that the vast majority of Bermudians recognize that this can, today it's someone who they may not know, but tomorrow it could be a member of their family in the hospital. And I don't think that anyone wants that.
I know this is going to be a concern among families that have shared custody. Will there be an opportunity maybe on Saturday or Friday for the children to switch households for the 2 weeks?
One of the things which I mentioned are the legitimate concerns which have been raised, and I'm sure that that will form a part of that concern. The Cabinet Subcommittee will be meeting. I do have a meeting scheduled to with members of the opposition as well, of where I will also seek their input to make sure that what we are putting out in these regulations for the next 2 weeks has broad community support, because it is important.
Very briefly, earlier you mentioned there was good news on supplies. Can you share with us what that is?
I'm not going to be specific, but the supply chains we have news of incoming supplies. The fact is that there's been I think I got an email earlier that there was a number of test results that were coming in. I mean, the fact is that we are ramping up what it is that we're doing, and it's due to the great work, as I mentioned yesterday, of the team in the Ministry of Health, who have had to improvise under incredibly difficult conditions. So there is certainly good news, and we're going to expect more good news, and when things arrive on island, we'll be happy to make sure that we share that there are things that have actually arrived on island.
At the moment, what's our full test kit supply that we have? How many do we have that's completely operational and being able to transport and do everything that's necessary to do the test?
Allow me to say this. We have more testing kits that exist than we do have swabs to do the test. So the limiting factor right now is not the volume of testing kits of which we have. The limiting factor is the swabs.
Okay. Dr. Peekball, the Premier may be happy to hear this, but I took his message to heart to do things during this 2-week period, and I've done a lot of the WHO courses on COVID, and it was very interesting when you were talking about the contact tracing. In the Bermuda context, what's the longest contact tracing train of positive results that we have, or cluster?
Very interesting question, and I'm sure I don't know the answer to that. I'm interested now to know. As I mentioned, it's a very tedious process. It involves calling and having a conversation with each of the contacts of a case. And I happen to know that one of the contacts had something in the order of 70, one of the cases rather had 70 contacts. So that is quite a web of information to gather and to follow out. And those contacts, it is entirely possible that a contact can become a case, become symptomatic, be tested, and turn out to be a case, and then contacts of that individual need to be reached out to. And so it becomes quite a complex web. I don't know if that gives you an idea of right. the magnitude of how it can kind of mushroom into being quite a complex undertaking, but the longest trail, I don't know. I'll have to ask our epidemiologist.
Okay. Along that way, on the Go data platform that WHO has, one of the fields is contact frequency. So, like how many times a person who's been positive was in contact. What are we seeing as sort of like an average number of people maybe outside the home?
Well, we've been very fortunate that because of the shelter in place, people are at home, and so for the most part, we have been able to reach contacts with 1 or 2 phone calls. But sometimes it's very difficult. You're right. And the GoData platform, I'm made to understand, is really quite user-friendly for those doing contact tracing because it's intuitive, and it also clearly was designed by someone who has done contact tracing because they know how difficult it can be to actually reach people. That can be quite a limiting factor, and it could be that the one person you can't reach was the person that you really needed to reach because that person ends up becoming symptomatic, and it only takes one overlooked contact for that to happen. So it is important to have contact tracing software, and we are going to be utilizing that particular one because World Health Organization has pointed out that it's particularly useful in these kinds of very large outbreaks. We do have software that we use ordinarily. We tend to have smaller scale outbreaks than what this has the potential to be. So we'll look forward to getting more familiar with GoData.
Okay. So in the case of the 2 rest homes, I'm assuming that everyone in the rest home, whether it's a patient or staff member, would then have to be contacted as part of the tracing process because of the workers involved?
That is correct, yes.
Okay. Thank you. Health Minister, in terms of support for these rest homes, because I'm assuming that we've had to remove people from being there and working, what support has the health ministry given them in terms of being able to keep functioning properly? Has it been necessary to call on additional people to make sure that they're running properly because of the positive cases there?
The support that the Ministry of Health is giving is twofold. One is for those rest homes that require supplemental supplies such as PPE. So we're ensuring that whatever their requirements are with respect to personal protective equipment, as well as cleaning supplies or any shortages that they may have, we're making sure that those particular things are provided. But in addition, as I indicated yesterday, we have a residential care home regulations officer. And what she has been charged with is not only contacting the rest homes to see what their needs are, but she's also in the process of putting together, compiling a list of potential substitutes that can assist with going into the rest homes where the needs arise. So that information, that process has been ongoing for several weeks now. And as I mentioned yesterday, around mid-March is when there were recommendations that were made to the rest homes to effectively start to reduce how many people, or reduce how many persons were working in their rest home and working at other types of facilities, other facilities. You would have heard us speak about yesterday the amendments that are going to come to the regulations concerning residential care homes with respect to the restrictions of ensuring that persons work at one primary facility so that we can prevent any potential spread of COVID from a person going from home to home to home. But she's charged with actually negotiating and engaging the rest homes concerning that.
All right, thank you.
Thank you, everyone. We appreciate this. Can you hear me? Many of the questions I have here on behalf of colleagues, so I do apologize if I go over ground we've already covered. To begin with, there was mention yesterday of a second rest home where there had been a case with a staff member, and we didn't want to have it named. We were wondering today if it would be identified, and if not, perhaps you could walk us through a bit of the reasoning behind, not divulging that to the public.
Yes, a rest home that has been named, say, by someone who becomes a case does not necessarily have a risk, so that the details of a case wouldn't be known to the public, and sometimes it's very difficult for us to convince individuals looking from the outside in that the risk assessment that's done around a case may or may not end up involving the other members inside the rest home or the staff inside the rest home, so that it is not necessary, it is of no public interest, it has no bearing on those who are in the facility or outside the facility. It's not information of value to the public, and so we do try to preserve the privacy and confidentiality of facilities unless there is an actual implication to a case to that facility. So it would be in that setting that we would not name a facility or an organization, a business, when it has no risk to public safety.
Thank you, Doctor. Minister, in terms of, and I tried to get at this yesterday, and I probably didn't phrase my question very well. In terms of restricting staff at rest homes moonlighting in different places. Is it fair to say, that's not a simple process to just go ahead and put in place right at the start of all of this?
Well, and so far as operationalizing it, once it becomes regulation, then the care homes will recognize that this is the legislative requirement. So therefore, I think if you want to be seen as breaching the law, that's probably perhaps one of the best incentives to prevent somebody from breaching the law, is that the law obviously will require that there will be certain penalties if persons don't abide by the law. So I can't imagine there's any more of an incentive than the strong arm of the law, so to speak, to ensure that people operate within the confines of the law and to work at their substantial or their full-time employment and not try to breach the law.
Thank you, Minister. Let's see, sorry. Hi. In terms of, we've been hearing of the X number, 35,000 cases of kits, rather, coming from the Cayman Islands. Is there any update on that, or the status of that? Are they coming, or do we know anything that we can tell the public about?
Here's what I would say. I would say on the broader level of the acquisition of testing kits, as the Minister of Health has said on a number of occasions, that all possible avenues are being pursued and explored. I would caution and beg for members of the media to not focus on the overall number. So let us say that a testing 35,000 tests arrived tomorrow, or 40,000 tests arrived on the next day, et cetera. The fact is that we don't have the capacity to do that volume of tests. So there's numerous things that have to go along with that, and all countries are having shortage. I remember this weekend when we were engaged in efforts to acquire swabs, one of the people who came back to us said, swabs are like gold dust right now. They're difficult to find. So I don't want us to get stuck on the issue and the volume of tests themselves. What I have said is that we are going to, and is the policy of the government of Bermuda, to have an incredibly aggressive testing regime. We have the one lab, which has been set up by Helix, which is doing incredible work for the government of Bermuda and the hospital. We have the second lab, which is being set up, where we're getting progress and updates on that, which will increase our testing capacity. The Chief of Staff of the Bermuda Hospitals Board has given another indication of that the hospital will be able to have some rapid diagnosis ability for things internally for them. So we are continuing to increase our particular capacity. So I'm urging persons not to focus on overall numbers and to focus on the fact that we have the capacity of which we need in order to test the persons that need to be tested, and we're going to increase that capacity over the next coming days. So I think that yesterday we had more tests in one day than we've ever done, and that's just going to continue to increase and to increase and to increase.
Thank you, sir. Questions from one of my colleagues, and this may just stray straight back into what you were just cautioning against. She was asking, we've spoken of, I guess we've heard that, if we just did nothing, we're looking at a potential scenario. If we carried on as life as usual, there could be as much as 80% of the population could end up infected. I've been asked to does that, given what we're doing now, are we looking hypothetically, I suppose, at a possibility that if it's not that number, that potentially as many as 350 people are at risk of being infected, even if we all do what we're told?
What I would say is that last week when we said we got the initial modeling information, we said that the cabinet was going to have that information shared. The cabinet had that presentation by the Minister of Health, the CMO, and the nurse epidemiologist, or the modeler. And we're going to present that information to members of my caucus tomorrow, also to members of the opposition, and following some tweaks that came from the cabinet, et cetera, that we will be releasing that to the public. But we're going to share the information which we have, which has been done on the modeling side, because we think that it's important that that information is shared and made public. We're not trying during this particular pandemic to keep information from the public. We want those persons to see. So the number that I gave was the worst case scenario. And so we will share those numbers of what we consider the better case scenarios if we are doing the things of which the country must do.
I believe the rest of these questions are modeling related, and as you said, we at the moment don't, these aren't answers that we can get.
I'm certain that following the release of that information, on the day in which we release that information, it's likely that we'll have officials from the Ministry of Health who can answer those specific questions.
Just a few more, sir. Apparently there was mention of some 40,000 tests that were on Monday. Anything we can say on that? I think you've already answered that.
I'm not necessarily certain what more to add. What I can say is that, as I had indicated, I think yesterday we had done more tests in a day than we have ever done during this period in time. We're going to continue to increase our testing capacity. Officials at the Ministry of Health have done excellent work over the weekend to come up with workarounds to enable us to continue this testing. There's additional validation that's going on a number of supplies which have been received. There's additional validation that's going on with a number of various testing machines which have been received, and we're going to continue to scale up our particular testing abilities as time goes on. So I'm confident that we're going to be able to reach the target of which we have set. The initial target is to get us to 500 tests per week, which seems a rather aggressive target. It's going to be rather difficult, but as I said, we're going to have multiple streams online, and all parts of the government are working together to bring on these multiple different testing centers so we can accomplish that aim. The best thing to do to manage such a outbreak is to make sure that we can test and isolate, and we're going to have the ability to do aggressive testing. And I think that was recognized by the figures that Bermuda has done relatively aggressive testing, and we're still going to continue to be very aggressive in our testing.
Thanks, sir. Home stretch here. Supplies on the way from China that I believe we touched on this yesterday in terms of embargoes and various disappointments you mentioned. That was touched on yesterday, wasn't it, Minister? It's a question we're getting a lot. Are we any closer in terms of obtaining a racial breakdown in terms of just generally of the numbers of people who are falling victim to the virus?
As I indicated yesterday,
Yeah.
it is a lot easier to look at somebody more often than not and be able to identify them by their sex. It's not that simple with respect to race and how people identify as a particular race. So because the referrals for testing come from the physicians, it means getting physician engagement so that they actually complete on the document what the race is of the individual and so forth. So it is a matter that is being explored, but it's not as cut and dry, so to speak, as it would be if you were just simply identifying by sex.
Thank you, Minister. A final question maybe for Dr. Peekball, and this is mine. We must presumably be near the end of flu season. Are we still getting a lot of flu cases? Flu must look identical to COVID in a lot of ways. Is that causing difficulty for yourselves?
You're right. It does look quite a lot like influenza, and so we are very grateful that we're nearing the end of flu season. It's important that influenza testing still occur, that kind of surveillance continue, because it does help to at least increase information about the diagnosis of a patient. Co-infection can occur. You can have influenza as well as COVID, but it is considered to be less likely if an individual comes, say, into hospital with flu-like symptoms and they end up having the diagnosis of an influenza. So yes, we're grateful that the season is concluding, though, because it will make it simpler. And it also puts more stress on the hospital that individuals are having influenza as well.
I'm grateful. Thank you.
Good evening, Premier. How are you? Good evening, all. And first of all, I just need to apologize to our garbage workers. They've given me questions as of last week and I didn't answer. But tonight you talked about laundromats. This is coming directly from them. Can you give a definitive date when some of them, not all of them, have washers and dryers? They need to get their clothes washed. They're doing work every day removing our garbage. Can you give a definitive date when some laundromats will be open to assist these, not just these guys, but everybody?
I think in my comments you heard me speak about laundromats, but if I would say that those are persons who are actually collecting trash as part of those services, I'll address that with the Minister of Public Works, and I'm sure that will be sorted out by tomorrow.
Thank you. Now, with the extension of the shelter in place, what factor plays in this part of the extension? Is it the number of cases spread in the community, or the lack of medical care if a surge? And what would the government need to see by May the 2nd to lift these restrictions?
The advice that was given by the Chief Medical Officer and her team and the Public Health Emergency Response Team was given the volume of cases which we were seeing and the chains of transmission that we should go through 2 full incubation cycles. It is always advised to go through 2 full incubation cycles, and so that's what we are doing in this particular case and instance. Chief Medical Officer, would you like to expand?
Yes, I think it's a really good question because it makes us think about why we can't predict far into the future around how long we will need to have these very severe social distancing measures. And it's because it is difficult to predict what's going to happen in terms of transmission within the community. So you asked about triggers, and in fact, that's a very important question. What are we waiting to see to let us know that it is safe for us to go outside again and to resume normal activities? And what would we need to see to let us know we need to again shelter in place? And that really has to do with the cases that are identified both in the community, but also particularly in the hospital, because the undertaking of sheltering in place is primarily to keep people alive. And you keep people alive by keeping them well enough that they don't end up in the hospital needing critical care, because those are the cases that have a poorer outcome. So our goal is to keep people from being the vulnerable, particularly, from becoming unwell and going to hospital. And sheltering in place allows us to see whether or not our hospital is able to handle the cases that have been presented to it so far. So in the last 2 weeks, we've seen a continuous increase in the occurrence of cases. That's worrisome. And if we had not seen that, if we had stopped transmission by the first week or at this point, we would have a very different recommendation. So similarly, as May 2nd approaches, we will be looking between now and May 2nd at the community surveillance information coming in from doctors referring patients with potential COVID for testing, and we'll be particularly looking at the hospital bed situation, how much occupancy is related to COVID-like illness or to patients with COVID. And we're hoping to see that reduce steadily over the coming 2 weeks, but it will require real commitment to sheltering in place. People have to take it very seriously and abide by the restrictions and understand that that's how we make the biggest difference here is these individual efforts to abide by public health advice.
Premier, with you extending the shelter in place by another 2 weeks coming this Saturday, we've seen people not abiding by the rules. Do you think that this announcement will change their behavior?
I think that most persons are abiding by the rules, and I think as there are more persons who may fall victim to this illness as it comes closer to home, that people will recognize that it's everyone's responsibility to help to keep their country and their fellow citizens safe. So though I talk and try to remind persons of the importance of this, I think that I also want to thank the vast majority of the Bermudian public who are listening to what we're doing, are heeding with what we're doing, are encouraging other persons to follow what we're doing, and are making sure they're doing their part to help us to enforce what it is that we're doing. So I want to thank the people of Bermuda who are cooperating, and that is the vast majority of persons.
The laboratory for Dr. Weldon, when will it be set up, and is it going to be accredited, an accredited laboratory?
You want me to have that?
Sure.
I got a message from Dr. Weldon today that said that the testing machines have been set up at the Southside Lab. The Ministry of Health, the Department of Health, has been working to prepare a space. They're going to then go through the validation exercise to make sure that the testing machines be validated, but they are from, as I said, donated by the company Roche to Bermuda. These are the same, these are high quality machines which have been approved by the Food and Drug Administration to do these type of tests, and we are certain that it will meet our standards and be able to increase our testing capacity. So we're grateful for that, and as I said, there's going to be a number of young Bermudians who are going to be involved in that particular effort and exercise to supplement the work that is being done by Dr. Spriggs at Helix Labs, and also the additional work that's being done at the hospital.
What is our current daily testing capacity at present?
I mean, our tests are limited by the number of swabs or referrals. So I think Dr. Spriggs should be like 96 a day.
As the Premier said, the tests are effectively limited by the referrals. So at this point, all of the referrals that are being made by the physicians with respect to testing of individuals are being conducted.
Okay.
Do you have something to add, Dr. People?
No, I was just passing something along, but that is exactly the case, which is that we are able to meet the demand, the clinical demand from the community at this moment. And the probable maximum capacity is limited also by by creating a system that can process a lot of people for testing. So those logistics will be being worked out in the weeks ahead as we get more capacity to test and more people are referred for testing.
Question for Dr. Richmond. Dr. Richmond, this question is being asked. Have there been any consideration to asking hospital workers not to wear their uniforms to work and wear their plain clothes and change? Staff infections can be passed instead of.
I have to apologize. I'm struggling to hear the latter part of your question. So could you repeat?
Has there been any thought about asking hospital workers not to wear their uniforms to work? They should change once they arrive at the hospital or rest homes. Staff infections can be passed. Is that possible?
So in terms of, you say, has there been any consideration? The answer to that is yes. And in terms of
It was a practice years ago, I've been told, by a retired nurse. I'm talking some 40, 50 years, when we've gone through a situation like this.
So in terms of the guidance is that we do request that staff, if they are wearing their uniforms outside the hospital, that they are covered, and that every effort should be made to not wear their uniform when not at work. And in terms of plans being put in place to provide the ability to change their uniforms at work.
Thank you, Minister Keynes. You've talked about a new virtual system for the inmates. I've been told that the possibility of Skype visits is on the tables for inmates and their loved ones. Is this true?
As you heard in the presentation that I gave earlier, there will be a form of virtual visits. As you know, the visits have been curtailed as a result of the COVID-19 regime that was put in place at the Westgate Correctional Facilities, at all the correctional facilities. The Acting Commissioner of Corrections has put in place. People will be able to do Skype calls and other forms of online calling. It will be like any other visit. They will write into the principal corrections officer. They'll fill out the appropriate forms, and a plan will be put in place for them to Skype their loved ones. Today, that process was a test drive took place, and it was quite successful. This is something that we're doing, Trevor, to make sure that we evolve with the times as the rest of our country evolves to online meeting and Zoom meetings to make the connections and to keep the connections. We think it's important for our inmates to be able to continue to visit their family, and we're also going to be using in controlled environments, practicing all the protocols for maintaining discipline, decorum, and the like. We're going to be conducting these visits by Skype.
Thank you. I understand that 2 persons were caught trying to smuggle marijuana into the quarantine facilities. Any word on this?
Was that a question?
Yeah. TNN also understands 2 persons were caught trying to smuggle, trying to sneak in a quantity of marijuana into the quarantine facilities. Do you know anything about that?
I do know something about it.
What's the process?
The matter is being handled. There was today, during the regular essential visit drop-off, somebody in the facilities managers did find a plant-like substance. That plant-like substance has been sent to the Bermuda Police Service, and the Bermuda Police Service are now handling the matter overall.
Any resolution has been reached reference to the feral cat population. That was a situation that went somewhat viral on social media about the over 500 wild cats. Has there been any resolutions in feeding these feeding centers?
Firstly, we are, as a government, concerned about our community. We realize that there are a number of people that are feline advocates, and our phones, our email system has been bombarded by the advocates sharing their position, and we've heard it. We have to put this in context because there was never a position for us not to allow people to go out and feed the cats. We believe that we have a very delicate ecosystem and that they play a part in it. The challenge was in the exemption request, there were over 100 people that applied for the exemption within one particular organization. And so clearly, we could not see it possible. Remember, we're trying to obviously limit social distancing, limit the amount of people that were on the road, and so we had the opportunity to revisit our decision, and we will be making that known to the relevant parties in the not too distant future.
I've also understanding that a facility on Front Street is doing some upgrades, construction, renovations. Has there been a special permit given to this facility?
Not to my knowledge.
I should name the facility, but I heard about this a couple of weeks ago. A pub bar on Front Street.
All construction as a result of the shelter-in-place has ceased. Should cease. We're encouraging anyone that has the opportunity to see something that is nefarious, that is outside of the law, not in keeping with the regulations, to make that information known. They can call 295-0011.
Premier, any thought of a special hotline for members of the public to call directly to Dr. People about any concerns, health concerns? It's just a question that I'm asking, sir. These questions come to me and I'm
quite
asking.
certain that Dr. Peatball is incredibly busy
I know she's busy.
managing
Yes, she
a
is.
once-in-a-century pandemic, just like the Minister of Health, the Minister of National Security, Chief of Staff Richmond, all the rest. I thank her for her time that she makes available here after a long day, and then in the evening when I go, we get emails from her later this evening as she continues to work. The team that are manning the hotline are certainly there, and they are able to answer the questions that are had. I've heard nothing but compliments. I want to thank all those persons who are manning those phones on a daily basis, and if there's questions and comments that come in that they can't answer, those things are pushed up the chain, and I've seen some come to us, and we've let them know what the answers are. But I would ask members of the media to ask any questions of the Chief Medical Officer while she's here.
My last question, any consideration of pushing back school, reopening way back to September?
There's been no consideration of that at this point in time.
And for May coming up, May 24th and the carnival, any thought of officially canceling those events?
I think that the minister,
Especially May
I think the
24th.
ministers who are responsible for that will make the announcements that are necessary in due course. I'm not trying to make the announcement for other ministers.
Sorry, last question. I still see online a lot of people comparing this to the flu, and it just might be helpful for the public to know, like in a typical flu season, how many people die in Bermuda.
I think we have the statistics.
This is definitely not the flu, and I think people are starting to recognize that. There was that hope early in the epidemic, but now that it's a pandemic and we see large numbers of people actually dying, the death rate for influenza typically is 1% or sometimes less. But for this, it can be up to 5% and higher in people who are vulnerable, who are over the age of 70. So it is many times more lethal than the flu, and certainly seemingly more easily transmissible. So it is posing quite a challenge for us in public health.
But in the Bermuda context, how many
People do die with influenza every year. How it is coded in terms of mortality statistics can be somewhat difficult to explain, in that often people who die with influenza have pre-existing conditions, and so it is the coding may not indicate necessarily that they died of influenza. They would have died with influenza and their congestive heart failure, for instance, or their uncontrolled diabetes. So that I think the question you're asking is whether or not there is an added an increase in mortality as a result of COVID-19 or influenza.
Well, I was just,
And
like
yes,
in a typical flu season, Bermuda loses 3 people, 2 people.
it's a small number that die strictly with just influenza, but not as a secondary cause. As a primary cause, it's a small number.
So
1 or
less than
2.
what's happening now.
Oh, yes. Yes, very small.
Yes, Mr. Premier, I have another question for you. Do we have rapid test kits here in the country right now? And are the test centers going to be private centers or just a government center? And my last question is, with the same question, are insurance companies covering testing?
I will let the Minister of Health speak to the insurance companies covering testing, and also she wants to add any additional details to do with the flu following what Dr. Pete Ball has said. I will then go on to your other questions, and then I'll go to wrap up.
Yes, the insurance company, if the testing is an accredited, recognized testing mechanism, then the insurance companies are covering the testing. And with respect to Don's question concerning the flu, just really quickly, I have some data for you. In 2020, there were 246 reported cases of influenza, of which 26, or 11%, did require hospitalization, and this is compared to a 5-year average of 139. And the cases peaking during the last week of February, namely the 23rd to the 29th, and cases remain higher than normal for 2 weeks of March, first 2 weeks of March, and have declined significantly since then to the below number of cases.
Regarding your issue of rapid testing, I think you're talking about serological testing. We are going through various processes of trying to validate any serological tests. We would have seen whether it's the United Kingdom, who ordered 17.5 million and had to send them back because they didn't work in a lot of other places. And so I think that the government is being cautious on any of those particular issues. And when there's announcements to make in that regard, I'm certain that we will make those announcements. Regarding the particular issue of just the question that came back, which had been something in which you had asked, Trevor, the Minister of Public Works, who is paying attention, has stated that he did have one request for laundry on Saturday from an employee at Mars Folly and did get it sorted on that exact same day. He has asked Mars Folly to poll any of the staff to see if there's others, and that will be sorted, which is in line with what I had recommended. So with that, I want to thank all members of the media for their questions on behalf of the people of the country. I want to thank persons in Bermuda for their continued attention, and I want to say that I continue to hope that we all maintain our social distancing and follow the rules and regulations which have been laid out. You're welcome to continue to make any suggestions of which you may have to myself directly or the other ministers, and I'd ask you to make sure that you listen and follow the official government news channels to get up-to-date information. Take care and have a good night.